In this video, we are going to look at health issues related to the human nervous system. So we will be looking at several nervous system disease. We should be thankful for having central nervous systems that functions well, because if the central nervous systems get damaged and stop functioning efficiently, this will be a big trouble. So in the following slides, there will be few examples of health issues related to the nervous systems. Now some bio insights right here saying that the risk of getting Alzheimer's disease is higher among individuals who rarely challenge their minds to study and think critically. So the lesson to take home is that we have to make use of our mind to do some critical thinking, to study, all right, to reduce the risk of getting this Alzheimer's disease. So the first disease, we look at epilepsy, which is the occurrence of abnormal activities in certain parts of the brain, causing nerve cell or the neurons to produce unusual signals. So the symptoms is that the person suffering from epilepsy may become unconscious, tidak sadarkan diri, and they will experience muscle spasm. That is the uncontrollable jerking movements of the arms and the legs. Okay. Multiple sclerosis. This is a progressive disease as a result of abnormality in the immune system that attacks the myelin sheath in the brain and the spinal cord. So when this myelin sheath is being damaged, what happens is that it cannot transmit impulses from and to the brain, hence causing muscle spasm, loss of coordination and balance. So compare here between these two neuron, healthy neuron and the neuron which is affected by multiple sclerosis. Okay, so the myelin sheath is being damaged and you get to see the exposed fiber, and that is the exposed axon. Okay, so some revision here. The basic structures and functions of the parts of neuron. So myelin sheath, still remember this is myelin sheath, and this is actually the insulating membrane that coats the axon. And the function, you can see the function is to protect the neurons from injury, as insulator for electrical impulses, even providing nutrients for the axon. So imagine if this myelin sheath is no longer functioning, okay, definitely it's going to affect transmission of impulses. Okay, that's multiple sclerosis. Moving on to Alzheimer's disease. Okay, this disease causes loss of ability to reason, to take care of oneself. So patient is usually confused, okay, forgetful, disoriented. Okay, yang kita cakap orang-orang tua sometimes, right, kita dengar mereka mengadu get confused lah, selalu lupa letak barang di dekat mana. Okay, so let's look at the top early signs. For example, memory loss, changes in mood. Okay, dia letak barang dekat mana dia tidak ingat, misplacing belongings. Hard to complete familiar task. Okay, ini maksudnya disoriented even in familiar places. Okay, dia macam tidak dapat mengurus diri. Confusion of time and place. Jam berapa sekarang, pagi ke petang. Okay, changes in vision, struggling to communicate, poor judgment, and even this social withdrawal. So if the deterioration of the brain continues, maksudnya kalau keadaan otak itu semakin merosot, what will happen is that the patient will lose the ability to read, to write, to eat, pun ada masalah, okay, even to walk and to talk. Inilah dia Alzheimer's disease. Okay, seterusnya, okay, masih lagi Alzheimer's disease. You compare sebelah kiri ini healthy brain versus Alzheimer's brain. Okay, so look at the picture, cerebral cortex dia macam mana, dan berbanding dengan otak pesakit yang ada Alzheimer's disease, di mana we see shrinkage. Otak itu seolah-olah menjadi lebih kecil. And that's why we see over here shrunken brain. Otak dia macam seolah-olah mengecut. And you get to see these dying neurons with tangles. Ini adalah neuron yang kita cakap yang bermasalah lah, yang telah ada develop pada patient yang ada Alzheimer's disease berbanding dengan healthy neuron. Okay, next one is Parkinson's disease. Parkinson's disease. It is the shrinkage, pengecutan nervous system that causes tremor. Tremor maksudnya dia ni tangan dia menggigil. Asymmetric resting tremor. Dalam keadaan dia rehat, kita nampak tremor ini, kita panggil dia sebagai tremor. Not only in hand, sometimes jaw, foot, even face. And the patient will have difficulty maintaining body posture. Okay, nampak body posture dia sudah menjadi begini. Postural instability. Okay, balancing dengan coordination dia pun ada masalah. You get to see cara dia berjalan. Kita panggil dia ni sejenis Parkinsonian gait. Slow movement. Dia punya arm swing sudah reduced. Okay, jalan macam robot dah. Rigidity, freezing. And this patient experience as well the muscle weakness. Okay, mask-like face, shuffling steps. Susah dia bergerak ataupun beranjak from one step to another. So this is Parkinson's disease. Okay, next one is brain paralysis ataupun cerebral palsy, which occurs because the brain damage before or after a baby is born. Could possibly occur in children between ages of 3 to 5 years old. So causes failure in the muscles and the ability of the motor neuron to function properly. Okay, cerebral palsy. Okay, Lou Gehrig ataupun kita panggil Amyotrophic lateral sclerosis ataupun dia punya akronim ini, singkatan dia ALS. So this disease is caused by deterioration and death of the motor neurons. Okay, motor neuron dia merosot. These motor neurons control the movement of muscles such as chewing, walking, and talking. So if these muscles is no longer working, the neurons are no longer working. So imagine the symptoms that will happen to patients with ALS. Okay, compare between the normal person and patients with ALS. Okay, kita lihat dari segi this one, neurodegeneration, damaged muscles, absence of signaling. Okay, kalau normal, kalau motor neuron is functioning normally, what will happen is that muscles will be able to receive all these signals, okay, given ataupun impulses from the motor neuron. But that if this motor neuron is no longer functioning, we say that the muscles dia tidak berupaya menerima the signals ataupun impulses. Okay, so some more. This is also ALS. Look at the normal neurons, normal nerve cell versus the one with ALS. Jadi nampak ada beza. Muscle contraction is able to happen in a normal person, but muscles is unable to contract. Dia tidak dapat menerima these impulses from the motor neuron. Okay, it says voluntary muscles no longer receive commands from the brain dan juga dia berada dalam keadaan atrophy. Atrophy. Jadi you see the muscles like it's smaller, atrophy ni. Okay, berbanding dengan the normal muscles. So patients experience difficulty in walking, weaknesses in the leg and also the hand, even slurred speech because it's affecting also the muscles at the mouth there, trouble in swallowing, even difficulty in keeping good postures. Okay, so ALS is the most common form of motor neuron disease. So let's look at the word. Kita dissect perkataan ini. Amyotrophic sclerosis. lateral sclerosis, amyotrophic. Okay, actually this comes from the Greek roots meaning without nourishment to the muscles. So notice cikgu sudah buat ini merah. A means without. Myo refers to the muscles. Look at the yellow ones. Trophic ini refers to nourishment lah ataupun feeding. Okay, bermaksud is like the muscles is not well fed. So it refers to the loss of signals, nerve muscles, to the loss of signal nerve muscles and normally sent to the muscle cells. Maksudnya, this muscles is no longer receiving signals ataupun impulses, nerve impulse from the motor neuron. Daripada perkataan ini, it tells us about what happened actually to patients with ALS. So lateral means to the side. So referring to the location of the damage lah in the spinal cord. Okay, next one is ADHD. ADHD means attention deficit hyperactivity disorder. Okay, so this is a type of brain disease that causes someone to become hyperactive. So therefore unable to concentrate and gets easily bored. So there are 6 signs over here in adults and children having this ADHD. Trouble listening, has trouble listening, dia tidak boleh concentrate. Avoid doing activities that require sustained effort. Okay, yang memerlukan patience ataupun usaha yang berterusan itu, dia tidak mampu melaksanakannya. Okay, the patient also struggles with organization ataupun time management, cannot sit still, talks and interrupts excessively, and frequently loses belongings, selalu hilang dia punya barang. Okay, so ADHD, kita tengok sometimes they show these behavior problems lah, anxiety and depression, learning disorder, peer problems, and mungkin selalu tercedera, increase in injuries because mereka ini adalah mereka yang hyperactive. Okay, autism. Autism ini adalah a type of disease related to development of nerves in the brain, which causes the individual to experience problems communicating, interacting. Okay, dia ada masalah. So issues with communication where the child doesn't respond. Kalau kita panggil dia tidak ada response. It's like the patient is like living in their own world. Okay, and prefers to be alone, trouble interpreting what others feel. Okay, sebab dia berada pada dunia sendiri, repetitive movements or speech patterns, dan tidak ada eye contact selalunya, sensitive to loud noises, eccentric way of moving. Maksudnya, punya cara pergerakan itu adalah tidak normal. Okay, so this disease is related to development of nerves in the brain. Okay, now this is the comparison, the differences in terms of aspects of differences between Alzheimer's disease dan juga Parkinson's disease. Dua penyakit ini adalah berbeza ya. Okay, so neurological disease which is characterized by increasing loss of memory dan juga dia punya intellectual ability. This is Alzheimer's disease. Okay, manakala for Parkinson's disease, it is actually the example of chronic disease of nervous system. Okay, Alzheimer's disease, in the slides just now, we saw the shrinkage of brain tissue. Okay, there is also because of the lack of neurotransmitter such as acetylcholine. But for Parkinson's disease, due to the reduced level of neurotransmitter, which we call it dopamine in the brain, and in some cases, maybe it is caused by hardening of cerebral arteries. Okay, usually affects the elderly, can also be inherited. Elderly, usually. But for Parkinson's disease, memang dia affects the elderly, and it's not a hereditary disease. Okay, kalau Parkinson's disease, yang kita kena take note adalah ada kehadiran tremor ini, tremor. Maksudnya menggigil itu. Okay, weakness of the muscles. Okay, patients shows loss of intelligence, loss of memory, Okay, berada dalam state confusion and poor concentration. Okay, the levodopa is administered. This one is in terms of treatment lah. Jadi sedikit perbandingan antara Alzheimer's disease and Parkinson's disease. Now let's look at the effects of drugs and alcohol abuse on human coordination and response. So there are many types of drugs used for medical purposes. For example, marijuana, which is used by doctors in small quantities to reduce nausea. Apa itu nausea? Nausea tu macam pening-pening, is a feeling of sickness. Selalunya come together with vomit lah, macam dia rasa pening, rasa mau muntah. So doctor is using this type of drugs, marijuana. So in cancer patients lah, usually dia guna pakai after they have undergone this chemotherapy treatment. However, kita ada case drug abuse, penyalahgunaan dada, other than for medical purposes. And this is very dangerous because it's going to cause serious side effects and would most likely be fatal. Maksudnya mungkin menyebabkan maut. So among the effects of drug abuse, drug addicts are memang addiction lah, ketagihan, which yang akan menyebabkan withdrawal symptoms seperti shivering, menggigil, sweating, vomiting if the drug is not taken. Jadi sekali sudah ketagih, apabila cuba stop, withdrawal symptom itu akan ada. Okay, so this table 12.3 shows the drugs and alcohol and the effects to the nervous system. Okay, first kita ada kategori stimulants ataupun stimulant drugs yang sudah namanya stimulants kan, stimulate. So keyword increase. Okay, increases the activity of the central nervous system. So if it is excessive use will cause temporary. Sementara sahaja keadaan euphoria, which is followed by depression. Okay, so they want to make use of stimulants sebab mereka mau rasa euphoria ini, but it's only temporary. What is euphoria? Adalah satu keadaan, perasaan, feeling ataupun state of intense excitement ataupun happiness. Okay, jadi disalahguna supaya mereka dapat rasa gembira, happy, euphoria lah kan. But selepas these drugs, the effects doesn't last long. After that, what will happen is the person who abused using this drug will have depression. Jadi, these are the categories of the stimulant drugs. Kita juga ada golongan kategori dada yang dipanggil depressants ataupun sedative drugs. Sedative yang buatkan kita lemah ataupun rasa macam mau tidur. So sudah namanya depressant, kita dinaikkan. Sekarang ini kurang. So this is going to delay the transmission of nerve impulse, which calms the mind. Dia punya efek depressants ini menyebabkan dia rasa passive sedikit, rasa tenang sedikit, like that. Okay, how about hallucinogenic drugs? Daripada perkataan halusinasi, so this will cause the user to hallucinate. Hallucinate maksudnya the user is seeing something which is not real lah. Okay, also it has these effects of relieving from pain and also anxiety. Okay, narcotic drugs delays normal functions of the brain. Delays. So narcotic drug or other substance, narcotic is actually a drug or other substance that affects the mood and also behavior. Okay, kita juga ada alkohol, minum arak, macam mana? Apakah kesan dia kepada the nervous system is that coordination dia terganggu, disrupts coordination dan juga thinking. Okay, selalunya orang yang selepas mereka minum minuman beralkohol, they are not allowed to drive. When they walk also, dia punya steps itu sudah tidak terkoordinasi because of the effects here. Delays the transfer of the nerve impulses as well. Okay.